Hello, hello, hello. Welcome, welcome, welcome. Come on in the room. Come on, y'all. We are here. It's Tuesday night tea, and I am excited. So welcome wherever you're coming from. Come on in wherever y'all are. Waiting on you. Y'all, where y'all at? Um, but welcome. If you are watching on StreamYard, I am using StreamYard. So if you would please give access for them to view your name so I can see who you are so that we can interact. And if you have questions, I would love to answer them. If I can, if I can't, I will get back to you and help you still get that knowledge and information. So again, welcome to Tuesday Night Tea. This is Facebook Live, the live lit podcast, Tuesday Night Tea, Facebook Live, all of that. So, hello, Coach. What's up? I missed you this morning, but I will watch the replay. It's just been a lot going on. But y'all, it is May. May is so fun. It's the best month of the whole year. Yes, I am biased, but it's one, Mental Health Awareness Month, and two, it's my birthday month. Yes, I celebrate all month long. So I just want y'all to be ready. I'm going to be excited and I'm going to be lit all month. Okay. Because it's me, my life has come, because this month has been created for me, but also I'm excited not just for my birth month, but also because it's Mental Health Awareness Month. And so it's two of my favorite things, me and mental health. So what can be better than that, right? But again, come on in. Welcome if you are watching now, 5 minutes from now, 10 minutes from now, 10 years from now. Welcome, welcome, welcome. We thank you for your support. We thank you for coming in and joining us. And again, please allow StreamYard to view your name if you are watching live so that I can interact with you just like Coach over there. So thank you wherever you are, if you're on Facebook or YouTube. So thank you for joining in. And y'all, I'm trying to wait. I ain't gonna lie. Hello, cousin. See, that's why I'm trying to wait so I can say hey to people as they come in. I miss you so much. I will be seeing my family next week, y'all, because about 15 kids graduating. I think I told y'all last week. It's so many kids down there graduating. Lord, I'm so proud of each and every one of them, though. But yeah, come on in. I guess I'll try to wait some more. But come on in and join this talk about mental health this week. We are going to be talking about a word that I can barely say, but it's a very interesting word. It's an I have to pull up my enunciation so I can say it correctly. Anosognosia. Anosognosia. Okay. Yeah. I can't even try to say that 5 times fast. Anosognosia. Anosognosia. It's like a tongue twister, but it's a very interesting condition. It's not actually a mental health disease or illness. Actually, it's symptomology that comes along with some mental health conditions. So I'm gonna go right ahead and start giving y'all this information about this. Okay, so again, it's anosognosia. But before we get into that, I want to give some respect to mental health awareness, to NAMI, which is the National Alliance on Mental Illness. Um, so each week, because of its being mental health awareness, I'm gonna try to acknowledge and bring your awareness to different organizations in the mental health arena. Okay, so NAMI is one of the biggest organizations that's out there where you can find all kinds of mental information on mental illness, and they also do an excellent job of mental health awareness. Okay, and so this year their mental health awareness month campaign is more than enough. And I love that because that just in itself is such an affirming statement, because we forget oftentimes that we are more than enough. Um, to get a little holy on y'all right quick, you know, we're more than enough because God created us, right? He made us more than enough. We are his best creation. So why would I think less of myself? Question. It's rhetorical. You could ask yourself that. Why would you think less of yourself? So sometimes we do say these things to ourselves like, I'm not enough. I'm stupid, or you call yourself names and all these bad things. And really you are more than enough. And so sometimes that comes from somebody else projecting things onto us about their own feelings, and they say things to us that are negative out of anger or whatever that might look like for them. And um they project that onto us, and so we start to believe that for ourselves, right? But I'm here to tell you, forget all that mess. You are more than enough, and I'm so glad that that's the campaign for NAMI for this year. And yes, Maggie, we are fearfully and wonderfully made, just some beautiful creatures, right? Each and every one of us, we're made in our own unique way. So for someone to tell you something less than that, um, you could say some bad words to them if you want to. But no, don't do that. You still love them with kindness, and still give them kindness. Okay. But this year, the campaign, and I'm going to read what Nami said. It's an opportunity for all of us to come together and remember the inherent value we each hold. And that is so important, the inherent value that we each hold, because our value doesn't come from what people say. It doesn't come from what people think. It's exactly what we are just talking about, that God gives us that value, right? Because we are alive, because we're born on this earth. And again, my value came into existence on May 27th, y'all. I'm not going to tell you what year. But anyway, they say that to remember that the inherent value that we each hold, no matter our diagnosis, no matter our appearance, no matter our socioeconomic status, no matter our background or ability. We want every person out there to know that if all you did, I love this, if all you did was wake up today, that's more than enough. No matter what you are inherently worthy of, more than enough life, more than enough love, and more than enough healing. Showing up just as you are for yourself and the people around you is more than enough. And I just love that. I love that statement, y'all. That I could just stay on that all night by itself, because it's so true. When I tell, when I work with people, I tell my clients that all the time. Nobody on this earth that is living and walking around, they can say what they want to, but they can't take your value away. Your value doesn't leave you. You are way more than enough, no matter what others may have told you, no matter what you have come from, right? No matter what you look like. And so that's why I love that they just put all that right there. Just so simple. But so let's move on though. So what is anosognosia? What is that? So it's actually from the Greek word to not know a disease. How can you not know what a disease is? Is it because of education or what, right? It's not really like that. So when we talk about anosognosia and mental illness, we mean that it's someone that's unaware of their own mental health condition, or they can't perceive their own condition accurately. So I researched a little bit, and the Cleveland Clinic describes it as a condition where your brain can't recognize one or more other health conditions that you have. It's extremely common with mental health conditions like schizophrenia and Alzheimer's disease. And there's a few others, but I'll get into them a little bit later. So they also say that this condition isn't dangerous on its own, which it's not. It's not contagious. It's not anything like that. But people with it are much more likely to avoid or resist treatment for their other health conditions. Okay. And so, in sum, anosognosia is a neurological symptom of some health conditions that refers to an impaired ability to understand and identify the health symptoms that you actually live with. So there's as I was researching all of it, there's different one, like there could be a visual, like you could have visual anosognosia, right? Meaning that you're not aware that you have a blindness if that's your case, okay? But something that I want to tell y'all is that when before we get into the diseases that or the mental illnesses that are normally associated with anosognosia, people sometimes get confused. The world society, they will view it as maybe that the person has a lack of insight or that they're in denial about their situation or their problem, but that's not really the case, because to have a lack of insight means there's something's missing, right? To have denial means that they're just using it as a self defense, as in to minimize or dismiss or avoid it altogether, right? So it's like I'm in denial that I have a eating disorder or something, but it's not so much that I'm in denial. It's actually a neurological condition that causes all these it causes me to not recognize it as such. Hey mama. So um cousin Maggie beat you on too, her and coach. I just want you to let you know that, mama. But anyway, so it comes from a neurological condition or a symptom. It's an actual neurological symptom that causes you to not recognize what's going on with you. And so if you are someone that you know has anosognosia, there are several signs that may be present. And so some of the things that you can look for are the physical and mental symptoms that somebody might say or do. So something like, that's not happening to me. So like, for instance, say someone had a stroke, right? And they have become paralyzed on their right side of their body. You know that they're paralyzed. They've heard the doctor say that they're paralyzed, but they believe that they could still use like their right arm or their leg or something like that, right? So they think that they're moving it, or they just don't recognize that they're not able to move their arm or their leg. Okay. They might say things like, I don't need any help. Um, what do I need medication for? Things like that. So some of those statements are ones that kind of kind of help you to recognize like, you might need to take this medicine, but you don't want to pressure the people because they're confused. That's what's wrong with it. They're confused and it causes confusion to you as well. Some other things that could happen also with denial, but there's a difference. So you could be in denial, but there's still just a difference to in the two, because it does come from a neurological place rather than just like a thought. So some other signs might include confusion or irritation about the diagnosis, inability to notice symptoms even when you point them out. Like, you can't move your arm, so they still don't notice that they can't do it. There could be a firm belief that there's no need for treatment. Also, refusing to talk about a condition or a symptom. So when you get around people and they just don't want to talk about it, they avoid it. Stopping medication out of feeling like it's not needed. Not that they feel better, but they just don't need the medication, okay? And suggesting that people are lying or making it up. So like they might start to believe that you're just making up stuff about them because they're really not aware that they have this condition. So some of the mental illnesses that go along with anosognosia include dementia and Alzheimer's disease, bipolar disorder, depression, eating disorders, and schizophrenia. So those are just some of the few that I found over and over again that this can happen with, right? But this list is not limited. These are just the mental illnesses that it could show up in. Okay, and so when you think about a person with dementia or Alzheimer's disease, you think, they lose memory, right? So they're not even aware that they might have dementia. And I can say this now, like my grandmother, she had dementia, right? Let me say it correctly. She was a person with dementia. So with that, sometimes she would not remember who I was, right? But then, or other times she might talk to one of my children and like think my daughter was me or things like that. So it was very confusing for her. But then she would remember, oh wait, no, you're grown now, and these are your kids. So she didn't even recognize that she had dementia, if that makes sense. So I hope all this that I'm saying starts to make sense. um, and so even like with a person with a bipolar disorder, sometimes they don't recognize that they have a bipolar disorder, especially when they're in a mania type situation. Like, so they have mania, but then they come back down and they are at a normal level, and then they're just like, no, there's nothing wrong with me. I was just feeling free. Like, I don't know, it just happens sometimes. So they're not even aware that they have the bipolar disorder, and that they need medication to keep them regulated. And so then they don't want to take their medicine. And so I hear so many stories from people that have bipolar disorder and their family members that it's so hard to keep them on medication, because when you start taking the medication, you feel like you don't need it because you're not at that level that you need it regularly. And so even with depression, and I know this is not something that I researched, but even with depression and anxiety, depression is there, but I didn't see anything about anxiety. But sometimes we could just be like, no, 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 I'm just, I'm all right. It's not that bad, but really you're super depressed or you're super anxious. So either way, and because bipolar disorder has both of those, you can go you can have the highs and the lows with bipolar disorder. That's why I kind of group the anxiety in there as well. So it's just not recognizing, you might in a depressive state, you may not even recognize that you have been laying around, not showering or anything like that, and feeling normal. But your family members are like, whoa, Juana, you need to go take a shower, right? But because I'm in a depressive state and I don't recognize it, that's what it would look like if I had some anosognosia. Okay. Same with eating disorders. It's, you don't recognize, you're just like, I'm doing it for, if you have bulimia, for instance, if that's where you regurgitate your food. So you could be doing that and just start blaming it on something else, like, oh no, it's probably because I have acid reflux, or my stomach was hurting. You don't recognize that it's not normal not to regurgitate your food. Okay. So I hope some of that makes sense. So what actually causes anosognosia? Now I'm getting good at saying this, y'all. Anosognosia. Um, so some things like, well, the main two categories that um the causes fall under are either brain damage or degenerative diseases. And so some of the degenerative diseases I've already talked about, like the Alzheimer's, dementia, bipolar disorder, and schizophrenia, but also Huntington's disease. So some of those brain diseases, they disrupt your brain's network of connections, and that's kind of a disruption that can affect your ability to update your self image. So that's why you don't realize, like what you look like or how, that functioning. And so that's what leads to the anosognosia, right? So like if you have the bipolar disorder and you start losing a whole bunch of weight, your brain connection has not updated your self image to show that you've lost a lot of weight, but your family members see that you lost all this weight. So that's what they mean about updating your self image. And so even like a a person that has had a stroke, like how I was talking about, if they have the paralysis on their right side, their brain hasn't updated itself to say like, oh, you can't move your arm. So that's how that's related. Okay. So the other part of what the other causes of anosognosia is the brain damage. And so most things fall under this category. So your brain is prone to injury like any other part of your body, just like how you could um, break your leg or arm or sprain, like that. Your brain is also prone to the same types of injury. So, damage to your brain causes injuries called lesions, and lesions are what cause anosognosia. And they can happen for any reason, such as an aneurysm, like a brain aneurysm, which would be a stroke, right? A brain tumor, which could also be cancerous or non cancerous growths. So, it doesn't have to be cancerous, but it just a brain tumor. Head injuries such as concussions or traumatic brain injuries. So people that play those high contact sports, they could have this. And sometimes when there's a lesion, I did find out that sometimes when there's a lesion or something like the concussion, it could be temporary. So this doesn't have to be long term, like in cases of dementia or like Alzheimer's or schizophrenia, right? So you can clear up from a concussion or you could clear up from a traumatic brain injury, and still be okay. So some other causes are cerebral hypoxia, which is brain damage from a lack of oxygen, and then infections like encephalitis, seizures and epilepsy, sleep apnea, again, strokes, and toxins such as carbon monoxide poisoning. So you know, at any time, any of us could be susceptible to having, something, one of these kinds of situations like sleep apnea. So many of us have sleep apnea and we don't even know it, right? Like, and that's something that you should get checked too, if especially if you have a partner and you hear them having breathing problems at night. If there's a lot of snoring, that's a one reason to go and get checked as well, okay, for sleep apnea. And so I'm just telling you those, like the sleep apnea strokes, because a lot of us genetically are susceptible to having strokes, especially. But these types of things could run in our family, and seizures and epilepsy even. So um, some other things that I wanted to share with you about anosognosia is like if you or someone, how can you help someone? So those are things that you need to look out for, are keeping yourself safe for one. If you're doing even if you're riding a bike, I just want you to know, even if you're riding a bike, wear a helmet. It's simple, try to protect your head in any kind of way, because that's typically, it comes from the brain damage mostly. So just protect yourself. If you have a mental health disorder that you're supposed to take medications for, take your medications, even if you feel good. Psychotherapy, such as talk therapy, can be helpful, but those are the main things: is just take your medication and talk to a therapist, right? Um, but mostly take your medications, okay? If you need to take them, if you're supposed to take them. I know some of us don't want to take medications, and I'm not pushing meds by any means, but some conditions you actually need to take medication to have a good life, to have a normal type of life, okay? So if you live with someone with anosognosia, or you know, someone you love, or you're caring for someone that has it, you might feel confused, you might feel sad or even frustrated, but these are natural reactions because you're their caregiver, you're someone that's taking care of them, right? And you don't want to see someone that you love or take care of not taking care of themselves, ultimately hurting themselves and harming themselves. So keep things in perspective and try to remember that this isn't something that they're choosing, because nobody chooses to have um, anosognosia, but it's something that is affecting them neurologically. Okay, so it's not their fault. It's not anything that they can really do to to change their results. Okay, they're not in denial of their symptoms, and they're not purposely trying to hurt you or themselves. So just be compassionate as well. Um, have grace for them, help them to just be compassionate about what's going on with them, because anybody with like any kind of medical diagnosis, they're going to feel some kind of way and they're going to be scared, and it might scare you or concern you as well. But you might be able to understand that it's not up to you or your loved one to heal from one moment to the next. Okay, it's just a part of the process. And I know, like, especially with dementia and schizophrenia and Alzheimer's, it can be really hard to deal with those loved ones, right? So just remember to have compassion and patience. Those are the main two keys in supporting them while they work on regaining some of their insight into their situation. Okay. Avoid arguments with them. Um, there's no need to argue. There's no need to be confrontative with your loved one, trying to remind them like, no, you sick, you better take this medicine. So don't, try to avoid arguments. And so just keep in mind that compassion and patience. Also, you could suggest going to family counseling with them, helping them. It will help you to avoid the friction, and also them. So you might find it helpful to seek professional counseling and support. And so remember, as a therapist, we don't take sides, but we are able to help you resolve conflict and make suggestions for treatment. Okay. And then take care of you, most importantly. So, you can be overwhelmed with dealing with these people. I remember one time I did it wasn't a presentation, but I was just like a guest speaker for mental health at this church. And one of the main things that the lady asked me to talk about was bipolar disorder, because she had a loved one that she was dealing with that would not take her medication. And something that really happens with this is that the her loved one was so unaware about her bipolar disorder, but she was, when in her manic stages, she was just relentless. Like, she was just reckless out there, just doing things. And so, but then when she would be back at a normal state, or what we deem as normal, right? She it was just like a whole different person. And so it was very confusing for their family. And that's why she wanted me to talk more about it, because so many of us are dealing with these things and we don't really know how to deal with it, or how personally to deal with it, but also how to deal with it as a caregiver, because it can be really frustrating and you don't want to just kick your loved one to the curb and leave them out there struggling, right? So when it gets to that kind of point, and that's what I was telling her, like, maybe y'all could go to family therapy and do things like that. And so she can have a better understanding of what her mental illness was and the effects and the impacts that it was having on her life. And so, so that's why I'm encouraging you to do that same thing. And so let's recap. So we can get up out of here. Anosognosia is a symptom of some mental health conditions as well as brain injuries. So remember the brain injuries and the degenerative diseases. It refers to impaired or diminished insight about your health condition and symptoms. And so when I say that impaired or diminished insight, you're not really aware, okay? It can impact many facets of treatment, like how you complete your treatment plan or take your medication. So remember, people typically don't want to take their medications because they don't believe something's wrong with them. And it can also impair them. I didn't mention this before, but like, when you're trying to work or things like that, like typically people that have schizophrenia or bipolar disorder have a lot of issues with work and employment because of the other symptoms that come along with those mental illnesses. So it's difficult for them to stay employed and having, like I said, like a normal life. Okay. And so for the best possible outcome, be compassionate, um, be patient, keep things in perspective, understand that what's going on with them, it also affects you, but take care of yourself as a caregiver, as a person who's caring or loving, to someone else that has anosognosia. Okay. So just take time for you as well. And I will always suggest counseling. And again, I like to just bring awareness to mental health in any kind of way that I can, just because it does help us grow. And so when you know something, you can do better, right? You know better, you do better. And so sometimes in many of our cultures, we don't have these talks. We don't know, we're not aware of these things. So whatever I can do to bring a more awareness, because it affects you, your mental health, your physical health, your spiritual health is like a little triangle. It all goes together. Okay. So whatever I can do to help bring insight and awareness to us, I will. If you have any topics or suggestions that you would like to talk about, or you have questions about it, please don't reach out to me. You can do it on Messenger right here if you need to. Just please don't tell any of your personal, like, a whole bunch of stuff like that. Or you could send an email to jlyles@litwellnessctr.com and I will try to answer your question. Okay. Or if you have a topic that you would like to know more about, I would, be glad to talk about that. So again, thank you all for tuning in. I'm glad to see some of my cousins on, and I will see you in person next week, cousin. So yes, like I said, I'm going to Texas next Thursday. So thank you all. Be safe out there. And before we end, y'all know what we say. I'm here, is now, and I am alive. I will see y'all next week.